नमो भगवते वासुदेवाय धन्वन्तरे अमृतकलशहस्ताय सर्वामय विनाशनाय त्रैलोक्यनाथाय श्रीमहाविष्णवे नमः.
Good evening, everyone. We welcome each and every one of you. Before moving on to the session, let's welcome our eminent faculty, Dr. Rahul R. Nair. He took his BAMS from Vaidyanathan P.S. Warrior Ayurveda College, Kottakkal, and MD in Yoga Nidanam from Pariyaram Government Ayurveda College, Kannur. Currently working as Assistant Professor and Head, Department of Yoga Nidanam and Vigruti Vijnanam, Specialist Consultant at Teaching Hospital, Ashtangam Ayurveda Chikitsalayam, Palakkad. Senior Visiting Specialist, Sidaram Pharma Specialty Clinics, Palakkad, and Medilife Polyclinic, Kutanad. Worked as tutor in Department of Kriya Shariram, Amuda School of Ayurveda, Assistant Professor and Consultant, MVR Ayurveda Medical College, Kannur, Evaluator and Examiner for University of Kannur and Kerala University of Health Sciences Graduate Examinations. He tries to explore the vast potential of Ayurveda in providing solutions for spectrum diseases like cancer, autoimmunity, pulmonary and cardiac disorders. We honorably invite you, sir. The dais is yours.
Marmabhigadam, Uroabhigadam, etc. So what are factors that can protect that particular areas that can also be instituted? Different possibilities exist. Mild fever, myalgia, loss of appetite, productive cough, dyspnea, all these can be managed by giving Vyakriyadi Kashayam, Dashamula Gadatrayadi Panam, and for assisting the fast recovery, also for expectoration, for bronchodilation, in order to give expectoration so that the secretions are not trapped inside the respiratory tract. You can give Acharishtam Kanagasavam. Also, in such cases where there is a lower respiratory tract infection with the purulent sputum, foul-smelling sputum, the patient is having dyspnea, heaviness of chest, etc., mild fever is there. Never hesitate to give Surya Prabha Gulika and Lakshmi Vilasarasam. And if the patient is having intermittent dyspneic episodes where the patient is having different difficulty, very severe difficulty to breathe, Swasanandam Gulika is another option, along with the Tambula Swarasa or ginger juice can be given. We used to give vaporizing once or twice a day to the patient, along with placing hot water bag on the chest and in the back of the patient, chest and back of the patient after placing a towel. So on the towel, hot water bag is applied. So that will give a dilation of the respiratory tubes and more expectoration. If the situation is worsening, you have to change your strategies. You have to step up the aggressiveness in which you are dealing the patient. Fever, expectoration, dyspnea, heaviness of chest, sometimes hemoptysis, the patient becoming very weak. One suggestion I will give, I will read from the last, Lajapeya. Lajapeya Sukhajara Shundi Dhaniga Pippili. This is a Peya Yoga which is mentioned in Ashtanga Hridaya. And even in some textbooks like Sarvaroga Chikitsa Ratnam or Vaidya Manorama or Chikitsa Kramam likewise, different Peya Yogas are mentioned, which can suit the clinical condition. Also, Ashtanga Hridayam, there is Vyakri Gokshida Sadhita Peya is mentioned. If there is hemoptysis, if there is chest infection. Dashamula Sadhita Peya is another option. Dashamula Sadhita Peya. So, in the Peya, instead of using rice, you can use this Lajam. Laja. I don't know the exact translation of Laja. So the Lajapeya, it is easily digestive and it should be processed with Shundi, Daniga and Pipili. That will aid digestion. In many palliative care cases, I have used this Lajapeya, and especially those patients who are in a level of Rajakshma where the digestion of the food is a big problem. Lajapeya happens to be a source of rescue, wherein when the Lajapeya is started, it happens to extend the life of the patient. Patient can eat in small quantities, multiple feeding times, always keep the patient in a sitting position and give or raise the bed of the patient and then give the feedings. And add Kasturi Kalparasayanam to the Vasharishtam Kanagasavam formulation and give it thrice a day. Daru Nagaradi Kashayam is another option. Now we can see there is Dashamula Gadatrayadi Kashayam, Vyakradi Kashayam, there is Belajiragadi Kashayam, there is Elaganadi Kashayam, and there is Daru Nagaradi Kashayam. Daru Nagaradi Kashayam, the indication states that Mrityu Kalpam Jaram Jayed. That means those patients who is destined to die because of this particular illness may be brought back to life by giving this particular kashayam. So it is very potent. I have noted in certain cases and also heard the experiences of some of my teachers, especially Dr. VKV Balakrishnan sir in Pariyaram Ayurveda Medical College, where he uses this Daru Nagaradi kashayam for treating pediatric pneumonia. So it is very effective. That can be given in multiple doses. Yoshadi Vadagam is another option. Also, there are another kashayams like Bhargyadi kashayam, Pathya Gatphaladi kashayam that can be employed. Rasnadi Churnam can be put as a talam for reducing the temperature. And another formulations like Mukka Mukkadugadi Guliga, Gorojanadi Guliga, etc. And Chukundippaliyadi Guliga. These three can be employed in addition to the drugs mentioned here to reduce the chest infection, to bring back the fever or the temperature down to the normal, and to bring back the life of the patient. Anyway, the cornerstone is to maintain the belem of the patient. If you are pumping in lot and lot of medications to the patient, and day by day, if the patient is weakening, there is no point in managing the patient. The patient may succumb soon. So maintain the bela of the patient by adequately giving the drugs like the peya, and then give very targeted therapy to the patient by using these medications. And once the patient recovers from this, if there is severe dry cough, mostly if there is a viral pneumonia, there is a post-viral hypersensitivity of respiratory mucosa. So there will be, even just by putting a fan, they will start to have a very dry cough, and attending chest pain will be there. Crepitation, span, chest fields may be heard. And in such cases, Elaganadi Kashayam and Lakshadi Churnam is a very good option. Lakshadi Churnam means Laksha Siddha Madhuga Jiraga Churnam. It is the Prakshepam of Elaganadi Kashayam that can reduce the severe dry cough, chest pain, etc. Agastya Rasayanam, if made classical, is very good for this stage. Classical Agastya Rasayanam means Haridagi is not ground into the lehya. Instead, it will be put as such. And the patient has to take 2 haridagi along with some lehya for one time. So, after recovery, the patient should be treated like this to bring back the lost rogi bela of the patient. And before winding up my class, my take-home message is this. In every fever, I have just gone through these different types of fevers, just peripherally told you about certain protocols which are drawn from those big therapeutic treasure troves. There is a lot more to take up. See, while dealing with this Kshadagasa, I think, and also in Swasa, there are Dhumapana yogas. Dhumavartis can be made. Manasila Dhumavarti is there. Some good Dhumavartis are there that can be employed. Then other therapeutic options like if the patient is having sufficient velam, some Sadhyo Vamanam can be done. Tatra Samutklishte, Utklishte, Samutklishte, Kapapraye, Chale, Male. Sahrillasa prasega annadvesha kasa vishujige. Sadyo Bhukta Sivodgare, Jware Same Visheshata, Vamanam Vamanarhasya. It is told rightly in Jwaram. So such procedures will wonderfully recover the patient back. And there is a practice of giving some Svedana in the chest in cases where there is a lot of pus getting, the sputum getting trapped, yet not coming out. In ancient Kerala textbooks, such practices of giving tavidu kiri, the kiri of the bark of rice, the husk of rice, is given. And I have heard a lot of experiences from senior Vaidyas who brought back the patient to life by giving this Svedanam of tavidu kiri in the chest. So, such when reading through the textbook, we can see that the management is gradually getting more aggressive when you are dealing with a Sanyabadija Jwara, especially when Dhadupagha is happening. So, in every fever, assess Bela Samprapti of Roga always. Hetvadi Karsnya Avayaver Bela Bela Vishesham. That means you have to think right from the Hedu. If you are hearing about the Hedu, which is an Agandu Hedu, which is a particular organism which is devastating effect, you can think that the Bela Samprapti is very powerful. Hedu, Rupa, Pururupa, all those things are standing in a highly exacerbated position. So think that the Bela Samprapti of Yoga is very powerful. The Bela is very powerful. Yoga Bela is very powerful. And then consider the Rogi Bela. Assess the Rogi Bela. We want to think about the different Sampraptis operating in the patient at a time. How the patient is like in this at this particular moment, how he was there 5 years back, what was the change in the body habitus, how his build has changed, how he was crippled to bed, what is the current status of his digestion, what is his acne, what is the status of Padani Domina. So thinking of all these factors, we can arrive at a judgment. And for specific mentioning, you can take the Dashavida Parisha of Charaga. So you will be getting a very precise measurement of what is the Yogi Bela of the patient. Compared to whether Roga Bela is more than Yogi Bela, you have to step up those strategies which can work out, which can give more focus to Yogi Bela, which can support Yogi Bela more, so that the patient can suffer or the patient can bear with this particular disease. Many a time, the illness, the disease, the Jwara kills the patient not because of its power, because of the weakness of the Yogi Bela. So, maintaining Yogi Bela by using suitable Peya is very, very important. And in Malayalam textbooks, there are a lot of different Peya are mentioned. Also, in Ashtanga Sangram, you can get different varieties of Peya that can be used. In Charaka Samhita is also richly mentioned. Peya is very much mentioned for preserving the Yogi Bela. Be careful to sense the Dhadu Pagam. See, when you get an electrolyte imbalance, when you see a patient who is suddenly having change in the mental attitude, when you see a patient who is having restlessness, when you see a patient with the sudden onset of loss of sleep, sudden reddishness of eyes, sudden change in the perception, the orientation, all these will point towards the Dhadupagam. The sloga like Nidra Naso, Hridistampo, Vishtampo, Gaurava, Aruti, Ariji, Aratir Balahanischa Dhaduna Pagalakshana. A patient who was walking in the evening, suddenly getting crippled to bed by the night. There is onset of Dhadupagam. Also use some very meticulous diagnostic modalities. For example, what we have used in the case of COVID-19, like a D-dimer, ferritin, the CRP, or such indicators which are pointing directly towards Dhadupagam, like SGOT, SGPT. So all those factors may draw your attention towards the ensuing Dhadupagam, and you can start therapies which can stop the fast progression of illness, reduce the Dhadupagam, and promote the Doshapagam. So the duty of physician is to regulate the Paga process well. So we are managing this case. We have to allow the body to continue with the Paga process, but the dosha Paga should happen. Dhatu Paga should not happen. Agni should be strengthened to create the metabolization of doshas, not of the dhadus in which it now resides. And always maintain yogi balam by prayadi krama. Be prepared always. Prepared in the sense that we have to continuously go through the literature. Reading Jwara Chikitsa from Charagam, Sushrudam, Ashtanga Sangraham, Ashtanga Hridayam. Then going through the different textbooks like Bhaishya Ratnavali, Yoga Ratnagaram, Bhava Prakasham, Kalyana Karagam. Then the new textbooks like Vangasenam, Basavarajyam, all these give you wonderful wealth of information. Nothing to say about those texts like Rasa Yoga Sagaram, Rasa Tarangani, Rasaratna Samuchayam, etc., which will focus, which will sharpen your prescription. So always be prepared and always read the clinical entities about the different clinical entities from the modern clinical textbook, so that you stay prepared to advise the patient regarding prevention, prophylaxis, management, and post-recovery care. For example, in the case of post-COVID, the post-recovery is very, very needed. So all those areas need to be updated, and the effort which we need to put in is much more than our allopathic counterparts. So what I finally want to say that once you complete reading all these things, surely you will be inspired to treat not only Jwara, but also all other entities in the textbooks. So let me close this session by giving my humble dedication to Professor Dr. Prakash Mangalasiri sir, who departed from away from us, who taught me Jwara Chikitsa when I was a final year BAMS student. So this presentation I am placing in his lotus feet, and also I wish you all the best in your further treatment. Let you manage all the diseases well prepared. Always increase the stuff in your hand and apply it in clinics, so that new information and such can be developed, and that can be shared for the betterment of all the physicians and all the patients. Thank you all for the very patient hearing. Thank you.